Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Today we're going to talk about top 3 causes of shoulder and rotator cuff pain, plus 3 sure fixes.
Right.
Right? Yes, right.
Sam is going to be very helpful today and
he's going to
showing
demonstrate.
This. But before Sam noticed, we got a few people out there.
Oh yeah, if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also go over to Facebook and like us. It's Bob and Brad, because Brad and I, as children, were not liked. It's a sad story. He liked us, but we're trying to turn things around.
Sam has always been with us. Okay,
right.
So Bob, shoulder pain. Now, I'm not talking about the pain if you fall off your bicycle or down the stairs and it's a traumatic injury where you obviously tear a ligament or break your shoulder. This is a real common shoulder pain that people get, whether it's be sitting at their computer, working overhead, or doing some repetitive motion. A lot of times they don't know where the pain comes from, and that's typical.
Comes on gradually,
right.
Tends to get worse. Some people are really shocked how bad the pain can get
from
some of these issues.
Right, and one of the biggest things is I can't even reach into the cupboard, to get a cup out of the cupboard at shoulder level. That's really affecting your life on a daily basis.
Right.
So we're going to talk about 3 reasons why you can get it, and the first one is that old term bursitis.
Yeah.
I remember it well because when I was like 10 years old, my mother had bursitis and she was in agony. And I had it sounded like a pretty serious term, bursitis, like a disease. It's really, I guess you could call it a disease process, but a bursitis is inflammation of a bursa. A bursa is a fluid-filled sac, and we just happen to have a nice model here with Sam.
The fluid-filled sac is designed to help things glide. So like if you have a tendon going over a bone, it'll help it glide. If you have muscle going over bone, it'll help it glide.
Right. It's the body's way to lubricate and keep things going for a long period of time.
So this bursa is helping the tendons that go over it glide.
Right.
And we'll show, so they're not rubbing against the bones.
Well, you can see right here, and this relates to our next diagnosis.
Right.
Here is the tendon for the supraspinatus, and right in here is where the bursa would be, and they're quite small usually, but this is
we put a huge one in there so you can see it.
It's exaggerated a little bit, but here you can see we got a fluid-filled sac, and you can feel it soft. This one's inflamed, overly inflamed. This person, Sam, is having a real tough time in his left shoulder. What are we doing with that?
So you can see when he lifts here, it provides some lubrication there, and it gives a little cushioning.
Right, but in this case it's inflamed and it's too much, and bursas happen to have a lot of nerve endings, so they sense that pain even more so than regular tissue. So that's the big reason right there. Inflamed bursitis.
We need to get that calmed down.
Right. Next one
is the tendonitis.
Tendonitis. And the supraspinatus tendon, which is, can you see that? Zoom in on that, Liz. Here's the location of it. The muscle's actually back here, but the tendon goes between this bone, the acromion, and your humeral head. And if you can you see that get pinched in there? Right there. Here, why don't you point with that, Bob?
So right in here.
As you lift up your shoulder.
Pinch.
Oh, yowie. Oh, yowie.
And that often comes from poor posture.
Right.
For example, I'll give you one just real quick example here. If you're standing here with poor posture, try to raise your arm up as high as you can go. Look how far I can go. That's it. Now, if I get good posture, it goes all the way up. There's room now.
Right.
When you're like this, it actually causes the pinching that could irritate the bursa and the tendon.
Right. It's a double header.
Sometimes you have both, by the way. Sometimes you have tendonitis and bursitis.
Very common. And then the last thing, in the same area, we're going to look at the bone. This is called the acromion bone. And you can get bone spurs that look like little icicles off of here. And that can be also impingement with the bone spurs. It's a double whammy as well. And we need to, oftentimes in surgery, they'll grind those right out. But you could try to work through that without surgery, of course. And that's what we're going to show you.
Yeah, you want to try to increase the gap there. And so if there is a bone spur there, maybe you can work around it and not have to have anything done with it.
You bet.
So we're going to show you the first exercise. Oh, no. The first thing we're going to do is a little bit of ice, right?
Right. Well, think about this. This bursa is all puffed up and sore and swollen. We need to cool it down with a cold pack. And Bob's got a cold pack right there. Now, you're not going to stand up and do this, But if you sit down, I like a recliner because you
Sure.
can recline back.
Well, not only that, the other thing I'm going to suggest, Brad, is that anytime you're up and about or working, I want you to get a pillow and put it underneath your arm.
Sure.
Now, you're thinking the arm doesn't really need support here because it's just hanging here, but actually this will help calm it down quicker by using a pillow all the time when you're sitting and give it some support.
Have a seat there,
as
Bob.
much as possible.
If you got a shoulder rest, it really helps a lot.
Yep.
You'll be amazed.
There we go. Yeah.
You know, I'll be in the clinic and we'll doing something to their shoulder, and then I'll put a pillow under their arm like this, and a big smile comes on their face and say, "Oh, that's so much better."
Yeah. And I tell them all day long, even in the car, try to support it somehow.
Sure.
You got to let that thing calm down. And there's, of course, even when you're sleeping, you can try to put a pillow on underneath your arm and
Right.
some support
right.
there too.
We've got some real good videos on sleeping posture with pills, and we can't get into that with this,
Yeah.
this video, but it's a really good adjunct to it. The next thing, Bob.
Well, NSAIDs.
Right,
you were mentioning.
ibuprofen, and that's a kind of a personal preference. I know my mother likes Aleve. I like ibuprofen, but it's
And if you take ibuprofen, make sure you're taking it with food.
Right.
It's really hard on your
Right.
stomach otherwise, and you want to make sure you have a piece of toast or something with it while
exactly.
you're taking
We've
it.
got a good video on ibuprofen as well. You can look at Bob and Brad ibuprofen. That'll pull up a good
Sure.
regimen for that. The next one is an exercise. Bob, you do have really good luck with this in the clinic. And I do too, but I think Bob is always good at this one to show it.
And so we're trying to increase the gap there because the larger the gap you have for the tendon to pass through and the larger the gap you have for the bursa to pass through,
Sure.
the less pain you're going to have.
Yep.
So this is a technique by Brian Mulligan, and you're going to find a countertop or something around about this height, or sometimes you can go a little higher. We'll show that in a minute. I'm going to actually push down into the chair, and while I push down into the chair, I'm walking backwards. The whole time I'm pushing down into the chair, and then I come back again. Now you want to go through a pain-free range. So if I start getting pain right here, I stop and I go back up again.
Sure.
And you can do this 3 to 4 times, rest, and then maybe do it again an hour later. I mean, again, this is something you could do 5 to 6 and 7 times a day. We actually, this is going to be called the Booyah stick. It may be out even by the time you see this video. What you can do is you actually push down and walk away from it. And this works really well because you can really grab onto this, Brad. I mean,
Right.
you can really get a good force going down.
Yeah.
And you can walk away like this and then come back into it again. And you can even do some of these, Brad.
Sure. Then
So-
you're moving the stick as opposed to your body.
Right. And again, you're going to find out generally after you've done this a few times, sometimes you can actually move the arm up
Sure.
more and with less pain.
Right. That's the goal.
So,
Then this is a standard exercise by
For
any therapist
strengthening,
you go
yeah.
to is a typical rotator cuff, external rotator strengthening. Elbow's going to be bent here at 90 degrees, not down here, not up here, but right there against your ribs. So-
sometimes we even have them put a towel there or something just
Yep.
to make sure you don't cheat.
Right, because if your elbow goes away, the towel drops down, then you know you didn't keep your elbow in the correct position. So that's why we have that there. And I'm going to do external rotation. Works really well with resistance band. You see we've got it to the wall anchor there. It works really well. And you can do 10 to 15 repetitions. And by that time, these muscles will be fatigued. And if you do it with your sore arm and then you go over and do it with your good arm, you're going to notice a big difference. And the goal is to get the sore arm strong enough.
Yeah,
to
you're
equal the other
strengthening
arm.
the muscles that help hold that ball into the socket.
Right.
So again, it's all towards the same goal. Create more space here. Get that ball into the socket so that it's not pinching. And that's what strengthening the rotator cuff does. Those 4 muscles work together to get that ball moving into the socket. Okay, this one's kind of a posture one and a shoulder strengthening one, isn't it, Brad?
Yeah, so I'm going to pull down this way. I'm not going to come way up here. I'm going to pull down and think about putting my shoulder blades into my back pockets.
Yep, so they're going down like this. He's thinking visually.
Yeah.
He's trying to put his shoulder blades into his back pockets, but he's squeezing the blades together.
There you go.
So this is one you can do, by the way, too. I mean, if you don't even have a band, you can just work on squeezing your shoulder
Right.
blades together. I'm amazed always, Brad, just even doing that sometimes at your desk, squeezing your shoulder blades together every hour or so,
Sure.
how that can even help decrease shoulder pain.
Right, you're using the same muscles, less resistance, but it's working again, posture, which really is key on shoulders.
So the last thing is cross fiber massage.
Yeah, you know, we haven't talked about this.
Yeah, that's for a long time, yeah.
but we really have.
I think we show it on here, Brett, because you
Sure.
can see the tendon.
Yes, get Sam back in the picture.
So again, one of the common impingement muscles is the supraspinatus muscle. And you can see, again, as the tendon comes off here, this all gets roughened up here.
Right.
And one of the great ways to actually work on that tendon is to actually put your arm back like this, and you can get on there and you can find the tender spot. I guess we're on me now.
Yeah.
And you can take one finger and put it over top the other finger, and you're going to rub right on that tendon.
Yep. So
And-
if you did it here, it would be right here.
Because what it's doing is you're helping break up the scar tissue.
Sure.
And a lot of times that scar tissue can give you pain in itself.
Yep.
So, and it's getting more blood flow to it. And you know, what you want to feel is that if you're doing this and it starts to hurt, it gets worse, it's probably too inflamed.
Right. I usually rule at 20 to 30 seconds. It may hurt, but after 20 to 30 seconds, it should start feeling clearly better or kind of a numbish feeling. Then you can do it for, 3 to 4 minutes until your fingers get sore, actually.
Sam must like it because he looks like he's smiling, doesn't he?
Yeah, look at that.
That's a smile.
Oh, he's biting Gumby's
Yeah.
hand. But yeah, that's the cross friction massage. It's one of those things that, again, don't do it too early when it's too sore. But if you had a sore shoulder for a couple weeks, it's probably ready.
Some people are surprised. I actually had some tendonitis, Brett, and it just wasn't getting better, And all I did was the cross fiber, and it went away in a couple of days. It was amazing.
Yeah, and I've had the same results here, and comments on our videos over the years.
Yeah.
It's one of those that people have, wow, thank you for that one.
All right.
You're welcome.
Remember, Brad and I can fix just about anything
Except for
a broken heart, but we're working on it.
Sam doesn't have a heart, Bob.
Yeah.